Hello, this is Dr. Pete, or just Dr. Pete, whichever you like. Board certified pediatrician, 19 years of experience. And I'm telling you, this is going to be a rough respiratory season. I would like everybody to understand that the flu doesn't care how you feel about vaccines or medications. The flu will make you sick and knock you down for 2 weeks. If you get the flu vaccine, it is very safe. There is a 1 in 100,000 chance that you might have a minor reversible adverse reaction. There's a 1 in a million chance that you will have a significant adverse reaction that might have prolonged side effects for more than 6 weeks. There is a very good chance, I would say 25 to 50% chance you're going to get the flu this year. It's going to be a bad one. That being said, let's talk a little bit about RSV too, our respiratory syncytial virus. That's our next respiratory virus that affects two groups of people disproportionately. It affects infants under 6 months very badly who can get an RSV monoclonal antibody. Pregnant patients can also get vaccinated during their third trimester, the last third of their pregnancy. And that can protect the baby too. Dads, there's nothing you need to do, which you're lucky. So just sit back and enjoy not having to get shots. But, if you're a dad like me and you're like, well, I don't know about giving my infant another injection. Consider this. There's an 80% reduction in hospitalizations. There's even higher reduction in severity of illness for infants that have received the monoclonal antibody to prevent RSV. It's a very good medicine. Let's see, what else? I've been around long enough. I've seen RSV do devastating things like put babies in the ICU, stop babies from breathing, put babies on ventilators, a breathing tube in their mouth and in their throat and lung, and a machine breathing for them. It's traumatic. Watching a baby hold its breath and not breathe when it has a virus and there's literally nothing you can do to stop the virus. You have to support them through it. You have to just give them the care that keeps them alive and then let the virus run its course. But now we have treatments. We have antibodies. We have so many more things. So please take advantage of these things. Our good friend COVID has not gone away since 2019. It's here to stay. It just keeps lingering. Maybe it's not as severe, but you know what still is severe? Long COVID. Long COVID affects 1 in 3 adults, 1 in 8 kids. It's not to be trifled with. Please just get your COVID vaccine. And no, I don't care what you think about mRNA technology, because probably what you believe is based on not even high school biology. So please, if you want to learn about mRNA, please pick up a biology textbook. Stop wasting our time with your nonsense. It cannot do anything to the DNA. It cannot enter the nucleus. It cannot alter the DNA of a patient. It is very safe. But if you're not going to get vaccinated, wear a mask. Wear a mask. And yes, masks work. They work really well for flu. In fact, during the 2020 and 2021 flu season, we saw a 98% reduction. Why? Because people were social distancing and they are masking. It really works. So just keep these things in mind. We're coming into the respiratory season. We'd love for you to come in and get vaccinated. We'd love to talk to you about why we recommend vaccines, because the disease is way worse than the side effect from the virus. The disease is way worse than the side effect of the vaccine. The virus is worse than the vaccine. Repeat, the virus is worse than the vaccine. The vaccine, you're going to get a sore arm. 2 days. That's it. Is aluminum safe? Yes. Are preservatives safe? Yes. Is the protein in the vaccine safe? Is the mRNA in the vaccine safe? Are the liposomes in the vaccine safe? It's all safe. We've tested it and tested it and tested it. There's no conspiracy theory. Me, 19 years. I don't get a paycheck from Big Pharma. In fact, I spend 5 to 6 figures every year paying for vaccines that I then administer to willing and consenting patients and parents. So, if you want information, follow me, follow my colleagues. We're on YouTube, we're on TikTok, we're on Instagram. Shoot, we're on LinkedIn. We're everywhere. We're trying to educate and we're trying to encourage community immunity. Community immunity means we all work together in a group project so that the people that can't get vaccinated because they have medical problems, they're too young, they're too old, they're on a medication, that we help them too. They're your neighbors, they're your cousins, they're your nephews, your nieces, your aunts, your uncles. These are people you care about. When you say, oh no, I don't have to participate in community immunity, you might harm someone that you care about. That's all we ask for you to think about. Think about the people that you already care about, then extend that out and think about all the people they care about and how we want to help each other. That's what it's all about. I actually make a better living if you are sick and you have to have tests and you have to have prescriptions to save you from deadly infections and deadly secondary infections. You put more money in my pocket by being sick. When I vaccinate you, you're not as sick, you don't come see me as much, and I willingly accept that I will take a hit financially in order to make sure my patients are safer and healthier. Because it's more important to me to have public health and community immunity and a safer, happier, healthier patient that hardly has to see me than it is seeing a sick patient all the time. We don't mind seeing sick patients, trust me. We do this for a living. We love taking care of patients. We love helping families. We love educating. We love hearing your stories. And the best part of my job is a baby that comes back and is as healthy, is recovered, and is smiling at me instead of crying because they have an ear infection. So know that we're doing our best to help you. We have your best interest in mind. We are not trying to tell you what to do. We're just recommending what we know is best. That's it. We can't push things. It's still your choice. It's still your decision. You still have some autonomy. Now, if you start hurting the community by spreading illness, then justice has to take over. And non-maleficence has to take over. And beneficence has to take over. But autonomy is important. People getting to make their own decisions is important. The problem is the information that you use to make your decision may not be the best information. And you might want to ask yourself the question, is this information coming from, yes, an expert? Is this information coming from a reputable source? Is this information opinion, or is it based in evidence and facts? You got to ask these questions. Unfortunately, this isn't the 1980s, the 1990s, where we don't have rampant misinformation on social media. And that's why I'm on here more and more and more, is to educate, and tell people what the truth is. Now, I get a lot, this platform, I get the most negative comments of all. And I have had the hardest time growing my subscription, so to speak, subscribers. And if you want to like and subscribe, if you agree with what you hear or you want to hear more, please share this, like, subscribe, whatever you guys want to do. But we care about you. Pediatricians care, doctors care. We never stop caring. We're just a little burned out, and we're going to carry on whether you like it or not. And then we're going to carry on giving best practices in evidence-based medicine and encouraging public health and community immunity. And we're going to base what we do on evidence. Thanks. Bye-bye.